first came to Guatemala in 1967 to conduct investigations in malnourished children at INCAP, a nutrition institute for Central America and Panama. My colleagues there were Dr. Jorge Alvarado, a pediatrician and hematologist oncologist. We worked with children with severe protein-calorie malnutrition for 5 years and produced a series of recommendations for treating malnourished children that are now used by the World Health Organization as their algorithm for treating malnourished children. The next phase was to expand our studies on malnourished children to include malnourished children that had secondary malnutrition due to gastrointestinal problems. And we formulated a plan, and we called that Plan de Xelajú. The following years, we began to do a collaboration at the Roosevelt Hospital in the pediatric department. Dr. Gustavo Castañeda was head of pediatrics at Roosevelt and very friendly with us. We developed a 4-year plan to investigate the nutritional problems of children that were recovering from diarrhea. And this proved to be productive. Productive in many ways. We didn't write many papers. Dr. Castañeda used to tease us about writing papers. But it produced some wonderful young men. There were medical students that became involved with Alvarado, and a former fellow of mine, a Guatemalan named Jorge Tulio Rodriguez, that had trained with me in Houston on gastrointestinal diseases of children. And they set up this unit, and we recruited 4 major medical students from San Carlos Medical School. They were Fernando Stein, they were Neri Flores, Alex Flores, and of course Tulio Rodriguez, who was the continuity between Houston and the center. And these people have all done well. We visited Guatemala many times. I don't know, I guess I've spent maybe a year in Guatemala in pieces. But these young people have all done well. Jorge Tulio is now the Dean of Nutrition here at Marroquin, and he continues to do clinical research as the chief of the clinical investigation unit for the medical school. The others are now professors at medical schools in the United States, and they've had distinguished careers. What was it? The impact was to think analytically, creatively, to write an algorithm or a protocol, and to carry it out. And these people all learned to think quantitatively and analytically. And some of the achievements, one of the achievements is really outstanding. Fernando Stein did the first total parenteral nutrition in Guatemala, 10 cases. And now every hospital is doing total parenteral nutrition. It's life-saving for people that have severe gastrointestinal failures. So that's a 40-year resume, and that's my pleasure to say that these careers continue to advance, and these people are academically sound. Well, the earthquake was a terrible misfortune, and we heard about it very quickly on television, and I went to the Harris County Medical Society to see what could be done from medical assistance. And I met there my friend who is now in Guatemala, and we began to make plans about what to do. And the Medical Society and other medical societies throughout the United States contributed a lot of goods. And we flew down the next day to see what the great needs were, and the needs were incredible. We went to Roosevelt Hospital, and the patients were lying on the floor because there were no beds, and they were in severe agony. about the broken bones, the broken spinal columns. It was very sad. And response to that got back to medical societies throughout the United States, and there were lots of supplies, especially medications for managing the severe pain of the orthopedic traumas. Well, every student is different, so the advice would have to be at the personal level, but the most important thing is concern for the individual person who is suffering. And that's what medicine is all about. Now, we do have epidemiology, we do have public health, but what the practicing physician addresses is the needs of the individual patient. Now, those needs can be met with simple approaches, or they can require very complicated approaches, as with total parenteral nutrition. And there again, it depends on the individual patient. But the most important thing is the willingness to have personal contact between the individual physician and the individual patient to resolve their individual problems. My greatest concern is that the candidate to be a physician be concerned about the individuals that make up humanity.